everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Methyldopa. Its brand name is Aldomet. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So the mechanism of action of Methyldopa in terms of lowering blood pressure is still not completely understood. However, it's thought that its major antihypertensive effect is from its conversion to methyl alpha-norepinephrine. This is because alpha-methylnorepinephrine is a potent alpha-2 adrenergic agonist. In terms of indications for use, Methyldopa is indicated to be used in the treatment of hypertension, oftentimes seen used in pregnancy. Now, before somebody was to use Methyldopa, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication cannot be used with a monoamine oxidase inhibitor. If a patient had a hypersensitivity to Methyldopa or any other component of the product, they would not be able to use this medication. If somebody had active liver disease, including hepatitis or cirrhosis, they would not be able to use Methyldopa. And lastly, they would not be able to use this medication if in the past, while using this medication, they developed liver disorders. Now, in terms of precautions, this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would want to avoid using Methyldopa in the elderly population due to an increased risk of CNS adverse effects, bradycardia or a slow heart rate, as well as orthostatic hypotension, which is a sudden drop in blood pressure when going from a seated to a standing position. Abnormal liver function tests have occurred in patients using Methyldopa within the first 3 weeks of therapy. Depression has occurred with the use of Methyldopa, so we often avoid this medication during the postpartum period. Some patients have experienced edema or fluid retention with the use of this medication, and discontinuation of the medication may be necessary. Jaundice, with or without fever, has occurred. This is typically seen within the first 2 to 3 months of therapy. If a patient had a history of liver disease or dysfunction, they should use this medication cautiously. And finally, liver disorders such as cholestasis and hepatocellular injury have both been reported. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Methyldopa, they can expect to receive their dose orally. So if somebody is using this medication for the treatment of hypertension or high blood pressure, they would typically start off with 250 milligrams 2 or 3 times daily for about 48 hours. They can then increase the dose in 2-day intervals, and to avoid sedation, they would typically begin the dose increases in the evening. Typical maintenance dose is about 500 to 2,000 milligrams daily, given in 2 or 3 divided doses. The maximum dose of Methyldopa would be 3,000 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Methyldopa, so I'll go over some of those here now. 15% of patients may experience dizziness, and 9% may experience a headache. 7 to 14% of patients may experience a reduction of libido. Now, some more rare but serious side effects would be congestive heart failure, pancreatitis, bone marrow depression, jaundice, or Parkinsonism. That's all we're going to talk about today with Methyldopa. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.